Rotator cuff muscles of the shoulder joint. There are four muscles which are subscapularis from the front, and from behind the three muscles: supraspinatus, infraspinatus, and teres minor. All these muscles originate from the scapula, and their tendons pass laterally. Towards their insertion, and the tendon of insertion will cover closely the capsule of the shoulder joint, and these tendons fuse with the capsule of the shoulder joint to strengthen and to stabilize the shoulder joint from the anterior aspect through the tendon of subscapularis, from above by tendon of supraspinatus, and from behind by tendon of infraspinatus and teres minor. And these muscles play an important role in stability of shoulder joint. And these tendons support the shoulder joint all around except from inferior. Therefore, the weakest point in the shoulder joint and liable for dislocation is inferiorly. This is the first subject in this video, which are the rotator cuff. Then we have quadrangular and triangular spaces. What are the quadrangular and triangular spaces? The long head of triceps originate from the infraglenoid tubercle and descend downward. This tendon or this muscle or this head of triceps, long head of triceps, passes in the space between teres minor above and teres major below. And this leads to creation of three spaces: quadrangular space laterally, upper triangular space medially, and the lower triangular space inferiorly. First of all, the quadrangular space. The quadrangular space limited and bounded from above by teres minor from behind, or from the front bounded by subscapularis. From front, this is the quadrangular space from front, bounded above by subscapularis. Therefore, the quadrangular space anteriorly, if seen from anterior aspect, bounded by subscapularis. Posteriorly, bounded by teres minor. From below, the boundary of the quadrangular space is teres major. Medially, it is bounded by the long head of triceps. Laterally, it is bounded by the surgical neck of the humerus. This space transmits the posterior circumflex humeral vessels and axillary nerve. This is quadrangular space, transmit axillary, or also called circumflex nerve, and the posterior circumflex humeral vessels, artery and vein. This is the quadrangular space which lies laterally. This is the upper quadrangular space. The upper quadrangular space is bounded by teres minor from above, if seen from posterior aspect. If seen from anterior aspect, is bounded by subscapularis muscle. From below, it is bounded by teres major. Laterally, it is bounded by the long head of triceps. Teres major posteriorly or subscapularis anteriorly. Teres major, long head of triceps. This space transmit circumflex scapular vessels. This space transmit circumflex scapular vessels, which share in the anastomosis around the scapula. We should notice that the quadrangular space and the upper triangular space are connecting anteriorly. What this? This is the axilla, and the structures here passing from the axilla to what? To the back of the shoulder region. Therefore, this is the passage, the quadrangular space, and the upper triangular space are the passages for passage of structures from the axilla to the back of the shoulder region. These are the quadrangular space and upper triangular space with the structures passing circumflex scapular, and here axillary and posterior circumflex humeral. This is more clear. This is a quadrangular space, axillary, posterior circumflex scapular, posterior circumflex humeral, and circumflex scapular here in the upper triangular space. Then we have a third space called lower triangular space. The lower triangular space limited by what? Limited anteriorly by, this is the lower triangular space, sorry. This is the lower triangular space. Limited medially by the long head of triceps. Above, limited by teres major muscle. And laterally, it is limited by this. What is this? Lateral head of triceps. Lower triangular space limited by teres major. Long head of triceps medially and the lateral head of triceps laterally. It contains what? This space transmit radial nerve and largest famous branch of brachial artery, which is called the profunda brachii. Radial and profunda brachii. It transmits this structure from anteriorly in the front of the arm to posteriorly in the spiral groove. Then we have a triangle called triangle of auscultation. Before we take triangle of auscultation, these are another picture for the quadrangular space, upper triangular space, and lower triangular space. And in this picture, it will be clear the triple relation of latissimus dorsi, this is the latissimus dorsi, and this muscle, teres major. The latissimus dorsi is first posterior to teres major. Then it curves to pass below the teres major. And finally, the tendon of insertion comes in front of teres major to be inserted in the floor of the bicipital groove. Triple relation. Latissimus dorsi is posterior, then below, then anterior to teres major muscle. Triangle of auscultation. The triangle of auscultation is a triangle on the back of the thorax, back of the chest wall, bounded medially by the lower border of what is this muscle? Bounded by the lower part of the lateral border of trapezius. Lateral border of trapezius. Okay? Bounded laterally by medial border of the scapula. Bounded below by what? Bounded below by the upper border of latissimus dorsi. The floor of this triangle here is this muscle. What is this muscle attached to the medial border of scapula? Rhomboid major muscle. This triangle is called the triangle of auscultation because if you auscultate, put the stethoscope on this triangle, the breathing sound is auscultated very good and excellent site for auscultation of the breathing sound. Therefore, it's called triangle of auscultation. Thank you for good listening and good luck.